I'm Karuna, working as a nurse educator in Vishakhapatnam. That's college, American NRA College of Nursing.
And what are you taking the OET for today?
I'm taking OET test to go abroad, especially UK, where my auntie stays there.
Okay. All right, so today, my name is Shinsen. I'm your examiner for the day. We'll do 2 role plays, and then...
Good evening, Mr. Mac.
Good evening.
I'm working as a registered nurse in this hospital. Especially, I'm taking care of you in this recovery room. How do you feel now?
I don't know. I'm completely disoriented. Where am I? What did you say your name is?
Yeah, my name is Karuna. I'm taking care of you today, and I'm very happy to tell you that your surgery was successful and your cooperation is highly appreciable. And now the time is 5 o'clock and your surgery was completed and you are under IV fluids. Is there any problem with you now?
Yes, there's a big problem. I don't know
What's
where
happening?
I am at. I don't know why did I have the surgery. I had a bad dream. I wake up and I'm not at home. And my daughter's not there, so can you please get my daughter for me?
Actually, you underwent hip replacement surgery, and you are in an operation theatre room. You are in a recovery room. So now I cannot call your daughter. I'm so sorry to tell that, because this is a recovery room and no one is allowed to come this room, because we are strictly prohibiting because of spreading of infection. So that we are prohibiting to visitors to come in this room. If you don't mind, you can see your daughter through the windows. I will allow her to come near the windows. You can see through the windows. Is it okay for you?
So if she cannot come see me, can I go out and see her? Would that be possible?
Oh, I'm very sorry. You obviously cannot go right now. After a few hours, we will send you to the room, the ward we will send, so that you can see your daughter directly. I'm very sorry.
I need to see my daughter. I don't know what's going on over here. I have no idea why I'm here or anything. I need to see my daughter.
See, I can understand your concern and your feelings.
Is there a doctor that I can talk to, so I can impress upon him? Because obviously we're not on the same level. I'm telling you that I don't know what happened. I just woke up and I'm very disoriented and I don't know what happened. And all of a sudden you're telling me about some surgery that I had and hip replacement or something, and my daughter's not here, so I don't know if she's worried about me. I'm worried about her, so I would really like to speak to a doctor if that's possible.
I can understand your concern. Actually, a few days ago you fallen in steps and you got some dislocation in your hip. So a few days before, that means 10 days before, you brought to the hospital, and we planned surgery today morning, and obviously we done a surgery at 2 o'clock and it was very successful. And now you are in the recovery room. As I mentioned earlier, you are in the very safe place. I am taking care of you, and your daughter cannot come here because we are prohibiting to come inside because of spread of infection. That is really benefit for you, because if someone is coming, now only your surgery was completed and you may risk to get some infection. So that's your benefit only I am telling. Is there any other concern? Is there any problem?
Yeah, my mouth is very dry, nurse. Is it possible that I can get something to drink? Maybe a cup of tea? It's already, as you said, late evening, so this is usually my tea time and I have had nothing to eat or drink, so can I get some tea?
Oh, really sorry, I cannot provide now, because now you are under IV fluids and just now you underwent surgery with anesthesia. So the main complication of anesthesia, if you are drinking some fluids, you will get the vomiting. So that now I cannot give. Definitely I will give within a few hours. When you are going to your ward, I will consult to the doctor and definitely I will provide some fluids. And if you don't mind, if you are telling that your lips are very dry, I can just wet your lips with a cotton ball for the time being. Is it okay for you?
Yeah, that would be much better than... So no daughter, no getting out of the hospital, I'm being held against my will, and then no tea or coffee, huh? So this is another form of corporal punishment over here. Is this something that's normal at the hospital, or is this something that all the patients go through?
Yeah, I can understand your feelings, but this is the rules actually. Immediately after the surgery, we cannot give anything by orally, and it's not some any punishment for you. It's common for everyone. After general anesthesia, we should not give anything by orally because you may prone to get some vomiting, and also now only your sutures may, when you are vomiting, when you are compression, your sutures may be dilated. So now I cannot give. I'm so sorry. And within a few hours, definitely we will shift to the shift to the ward so that you can see your daughter, and also we will provide some fluids to drink.
Okay, sounds good. Thank you.
Thank you. Good evening.
Good evening.
I'm Karuna, one of the registered nurses in this hospital. Tell me, how can I help you?
You're just the person I've been waiting for. So, my father's been waiting for his surgery since 10 a.m. He's not had anything to eat since 7 last night, and we've been in a holding pattern. He's not been administered any fluids, any food, any medications. He's a heart patient. What's going on? I'm really upset. I'm really irate because there's been no communication from your staff, from your management team, from the doctors. Nothing's been communicated to us.
Okay, I'm very sorry to tell you that because of one other patient is having the long surgery, so that is the reason your father is delayed bit. Definitely we will take to the surgery within a few minutes. Don't worry. Definitely after surgery we will give some liquids to him. Is there any concern?
Yes, that's the concern, right? Here's an elderly patient. My father is old, and he's been waiting, and apparently there's a communication gap or something that's not been communicated. So this was supposed to happen about an hour ago, right? Not now. We're going into lunchtime, and he's not taken any medications. He's not even gone to pass urine.
Okay.
So we don't know if it's okay to do that, if it's okay to do this. Some form of communication should have been, that's the standard level of care that you'd expect, some level of professionalism in that sense. And you are a multi-specialty hospital, so you do prepare for these contingencies, and you would expect that this is not the first time that you have some complication that happened in one surgery, so you're going into overtime for that. So that is a natural event that would be expected, but the communication gap is completely missing. So
actually, I'm very sorry to tell you, I'm very sorry for this delay. Actually, I can understand that we're supposed to communicate earlier, but the staff were very busy in the operation theater and no one can come to you to communicate. So I'm very sorry to tell you, and definitely I will convey this message to the doctor immediately, and we will post the time of surgery for your father, and definitely within a few minutes I will send your father to surgery. So that don't worry.
You're giving me excuses, so let's. What level of assurance can I have from you and your team that these lapses will not occur again? What guarantee do I have, or what level of confidence can I expect that from?
Definitely, I can give I will be assured to you that this will not be happen again, because I can really sorry that our staff is really busy with some other surgery and we delayed to come to you. I can agree that, and I'm very really sorry to tell, and I assure that never it will be happen from our side. Definitely, your father will be sent to the operation theater within a few minutes, and I will convey this message to the doctor, and we will document this complaint from you, and we will take care that never it will be happen again. And definitely your father will go to operation theater within a few minutes. Is that okay for you?
Yes, because otherwise I'm just going to discharge him and take him to another facility. It's a deplorable level of care. If this continues, then that's what the remedy would be to that. I'm not the only patient waiting, right? So you have several surgeries scheduled for today, so I think all those other patients are also waiting to be communicated what's going on. Some level of transparency would be permissible in this case. Of course, I'm not saying that you have to share every patient's situation with the rest of us, but at least give us some level of communication on there, what's going on, what kind of a timeline are we looking towards?
Yeah, you're right, and obviously we are sorry from our side.
I don't know if I should tell my father, Dad, you can use the restroom. I don't know. I'm not the doctor. I'm not the nurse.
Yes.
So when he asked me, "Can I use the restroom?" I tell Dad, "No, you have to hold it." How long is he supposed to hold it? He's been holding it since last night. So no food, no medicines, no medication, no water.
Okay, I'm very sorry to do this, but really we are very busy for the previous surgery. It was very
So if you're
complicated.
short-staffed, that's not my thing, right? So maybe you should
Yeah.
tell us, please do not admit patients anymore. We're short-staffed. We're short-handed. You need to let your patients know before they're coming in, because you cannot administer the level of care or standard of care. So that would be something that you communicate before patients register at your hospital. It is a multi-specialty hospital. If I work in project management, so I know how contingencies can appear and priorities can be shifting. So you want to prepare for that, but that.
Yeah,
that's-
actually, you're right, and I can agree your concern. But the thing, the surgery before your father is very minor surgery. We expect that it will complete within a time, but unfortunately, it has taken a long time, and we cannot communicate within a time. And we are very sorry that. And as I mentioned earlier, definitely I will convey this message to our higher authority, and we will take some precautions. It will not happen anymore, and definitely we will take special concern to your father. And definitely we will give some interventions to your father as
Okay.
early as possible.
Thank you, Karna.